Live from Washington, D.C., Jay Sekulow Live. Phone lines are open for your questions right now. And now, Chief Counsel for the American Center for Law and Justice, Jay Sekulow.
So this did not get a lot of attention, but it should have, and that is the president put in place a policy that was initially adopted by President Reagan, and that is Title X funding would no longer go to organizations that have facilities there performing abortions, and it's to the tune of $60 million. Now, that is a far cry from the $400 million or so that Planned Parenthood gets every year. But the $60 million is money coming out that's no longer going to be going to Planned Parenthood. In other words, if you refer for abortions in your facilities, you're not getting this money. The money is allocated to other centers, and it's important to point that out. Here's what we'd like to do on the broadcast. We're going to go through the particulars of what this means. It's a very positive step. It's what the president could do under his authority, which is what has been done through HHS, Health and Human Services. It is, I want to keep it distinct from this whole issue of, which is important to understand, this entire issue of Planned Parenthood's other Medicare funding that they get, Medicaid funding that they get. That's different. But this was another $60 million revenue stream of Planned Parenthood. So we want to know from you, number one, what do you think about this step, that no longer your taxpayer dollars, at least $60 million of it, not being utilized for Planned Parenthood. But number two, and that is those of you that have had this experience with Planned Parenthood, we'd like to hear from you. We get those calls, but again, your taxpayer dollars, at least $60 million of it, not being utilized for this. Let me go to CeCe Howell, Senior Counsel for the ACLJ, does a lot on the pro-life issue. CeCe, in looking at this, how do you view this issue? I mean, we're going to get into the particulars, right, but I call this a $60 million win. Is that correct? It's absolutely correct. It literally is a 15% hit to federal dollars flowing into Planned Parenthood, and that's not insignificant. You know, especially when you have 6 out of 10 Americans against federal funding of abortion. The president is standing up for the majority of the American citizens out here, and I think it's very significant. Politically, this was not, Jordan, the $400 million. I'm going to go to Jordan Than on this. The $400 million, it's different.
No, that would take Congress. That takes Congress. The president would sign that. He said he would sign that full as what we'd call a defunding of Planned Parenthood. And so we want to separate that, and the president has made that clear as well. This is taking funding away that he can do on his own without Congress already authorized this a long time ago. This has been on the books, but he, like Ronald Reagan, was willing to do it. So the law is clear. It says none of the funds appropriated under the Title X shall be used in programs where abortion is a method of family planning. Very clear law since the 1970s, but only Ronald Reagan and President Trump, who's now reinstating that, have taken the action to follow the law. And Congress, when past presidents didn't, like Obama, like Bill Clinton, didn't follow the law and changed that HHS rule around, Congress did nothing. So this is where the president can act to save lives.
All right, so Than, quickly here, this is not a situation where this is not the other money that Planned Parenthood gets. We need to draw that distinction.
It's not the $400 million, but it's a monumental victory for life. And Jay, I would say this, it's also a monumental victory for women's health, because this $60 million will actually flow to women's health care now. So here's the question I'm going to ask this to Logan. So you got young people, I say young adults, understanding that their taxpayer dollars not going to fund abortion. That seems to be an issue right now that your generation understands. Money shouldn't be going there.
Yeah, I think a lot of our generation do. I mean, obviously, at both sides of the table, I think there are a lot of people that will not find this to be a positive, but there's the people that do. This is a huge win and should be treated that way for the people that feel that way. But it's definitely not a non-divisive issue, and I'm sure we're going to hear a lot about it.
All right, we've got a lot more ahead on this issue, and real battle ahead on this as well, I might add. And we're going to need your name on this petition that is going to be going with our comments. So we want to be able to say that there are so many people that have signed on to our comment section, because we're expecting Planned Parenthood. You heard what Than's saying. I mean, it could be tens of thousands, hundreds of thousands of people on the other side of this. So you signing on to say we support this change, what the president's put in place here on the pro-life side, will make a difference. The number is 1-877-989-2255 to sign on to that petition. 1-877-989-2255. I encourage you to do that. Now, you can also, of course, go to aclj.org. That's aclj.org, and sign it that way.
The fight to protect life is intensifying. Now, with the Trump administration at the helm, efforts are ramping up to defend life and defund Planned Parenthood, the nation's largest abortion provider.
In reality, what abortion is the taking of an unborn child's life.
Planned Parenthood receives hundreds of millions of taxpayer dollars each year. And at the ACLJ, we're working with the Trump administration and members of Congress to stop the flow of taxpayer dollars to Planned Parenthood.
America will look back on this season in history and will be mortified about what happened in the abortion industry.
I didn't want anyone to see me. I didn't want anyone to know.
We're aggressively fighting on Capitol Hill to stop funding big abortion. The time to do that is right now. Add your name to our petition to defend life and defund Planned Parenthood. Call 1-877-989-2255. That's 1-877-989-2255, or you can add your name online, aclj.org.
So, about 4 days ago, the White House announced that the Department of Health and Human Services filed a proposal to protect life by updating the Title X Family Planning Grant Program. The proposed rule changes were released on yesterday on May 22nd. We will be filing legal comments on that. The proposed rules change will ensure compliance with the ban of federal funding for abortions by denying Title X funds to family planning organizations that prescribe abortions. Now, we had joined, the ACLJ joined with 85 other pro-life organizations supporting this change in a letter on May 1st. Having said that, we now have the proposal is out there, and now what we have to do, and this is what you have to do in situations like this, there's an open comment period. So I'll let Cece address this. So and both sides are going to engage this.
Correct, and they do. We have 60 days for public comments from either side, whether you're for it or against it. And then depending on what happens with the public comments, then there possibly could be a 30-day delay before we see any enforcement. So
I'm expecting fan comments from the other side. That's normal here. But we've got to be aggressive on this because I'm already holding a Democratic fundraiser yesterday. Here it is. So it's already politicized, obviously. So we got to expect this. And you say they're a big lobby.
The response is going to be overwhelming, Jay. I mean, and that's why we're engaging already. We already have a team drafting our comments on this. I will say this. The president is right as a matter of the rule of law as well. Ever since 1970, there has been a very clear prohibition on abortion providers accessing this account, and yet they have done it, Jay. But look, I'm looking at the same email you are holding. The other side, the pro-abortion lobby, is going to be out in full force. I guarantee you they're going to have tens or maybe even hundreds of thousands of comments on their side. But we're going to push back.
Did you say hundreds
we are
of
going to
thousands?
state that. I think that's very possible, yes. I think this is going to bring them out in force.
So here's what we're going to have to do. We're going to have, like I say, we've got about a 60 to 90 day here. We're going to have to go ahead and very clearly, we're going to have to do what we would do on a situation like this is have a sign-on petition so that we can be representing you all. So be the American Center for Law and Justice and X number of people that are supporting the position we're advocating. So that's something we should get in the works and tell our media teams that we need to get that, because when the number what Fan just gave that's pretty shocking. All right, do we want to go ahead and take a phone call?
Yes, we're going to have Mike online too in San Diego, California.
Okay. All right, Mike, go ahead.
Hey, Jay. Okay, so I do evangelism in Balboa Park here in San Diego, and I've gotten to heated discussions with the atheists. We've talked about this, and I want to know exactly how is tax money used for abortions? Please explain that to me.
Well, I mean, right now, $400 million of your taxpayer dollars goes to Planned Parenthood. And what happens there is, while they'll say they're not using it for abortions, Jordan, it's a moving – that's $400 million of other money because that's a government grant basically they're getting.
Yeah, I mean, between 2013 and 2015, $1.3 billion just to Planned Parenthood. So that's not to all abortion providers, but just to Planned Parenthood Federation of America, $1.3 billion. So when you put that together, you understand here they are able to fund all of their activities outside of the actual abortion services with our dollars. So you're propping up an entire industry. It's like it's like drilling the oil for the oil companies and then letting them sell the oil or let them do research for free. And that is what's important here.
Yeah. All right. Let's let me ask this question. So from CC's perspective, because you deal with a lot of these pro-life cases, we have a pro-life case pending at the Supreme Court of the United States right now. There's going to be a decision in a companion case, could come down literally any day now. It's going to certainly come down in the next 4 weeks for crisis pregnancy centers. But you got to understand this, folks. You know who we're fighting on these? It's the National Abortion Federation. It's Planned Parenthood. Yeah. Those are our so when you talk about when Than throws out a number like tens of thousands of comments or hundreds of thousands of comments, this is a big lobby you're fighting.
Yeah, and they're very much engaged, and they can rally their troops. And, I look at even the memo you said that the Democrats sent out. They use verbiage like critical reproductive health care. So this new rule is going to block millions of women from accessing critical reproductive health care. Let's just be clear. It's only abortion that it's blocking. And they try to always change this terminology to make it look like we're harming women and their access to health care, which is just not true at all. It only affects abortion.
It actually doesn't. When we talk about these cuts to these organizations like Planned Parenthood, I know some of you would like to cut the federal budget for various reasons, but this is not actually taking the money away from the government. It's not saying this $286 million budget of Title X, this affects about 50 to 60 of Planned Parenthood. That 50 or 60 million dollars can now go to actual healthcare providers for women's health that aren't just abortion, basically the abortion industry and the abortion giants. So this will be money that will still be utilized. It actually opens up money and resources to those who don't provide abortions to provide health care.
I think it's a good time to take Pat, who actually has that similar point of view when it comes to the fact that she just doesn't believe that the federal funding of Planned Parenthood should be happening, not necessarily opposed to them as a company or as an organization. But I think that's an interesting comment. Pat, you're on the air in Oregon.
Hi, Pat.
Hi, how are you?
Good. Thanks for calling.
Not a problem. So I just want to reiterate, I'm one of those I'm in my 50s, but back in the early 20s, I ended up having an abortion through the Planned Parenthood. I was young, I was stupid, I had no idea the effects that it would have on me. But the other thing that Planned Parenthood did for me, they caught pre-cancer cells. So the organization is really, really good. But I think because these young women and men do not understand the complications that it can cause as far as an abortion, that if these abortions want to happen, that they need to come out of their pocket. And maybe if they understand the cost of what an abortion is, not only to their body, but to their pocketbook, and stop depending on us taxpayers to pay for it, I think that might change it. Because I have a daughter in my early 20s, and she's pro-life, and I'm a Christian now. I mean, this was before I rededicated my life. So, so it's like they think this Plan B is okay. They think abortion is okay. In all reality, in Oregon, we have an OMSI facility that actually shows each and every month stage of the life.
Yep.
And they just think that as soon as they have a baby, it's not a life until it actually forms into a human. And it's like they don't understand.
So this is where the women's health centers, the crisis pregnancy centers, we used to call them in the 80s and 90s, now women health centers, have done a phenomenal job. What they're not getting is $450 million from the federal government, Than.
This goes back to what CC and Jordan were just talking about. This is not a docking of $60 million. In fact, it is freeing up $60 million that previously went to the abortion industry for exactly what Pat was describing. Jay, those dollars should go to programs that actually provide the services that Congress intended to provide when they passed this law all the way back in 1970. That's why this prohibition was in law, so that those dollars reach the women like Pat who actually need them. Jay, what this does is rightly restores the fact that those dollars will reach the women who need them. So, the other side is going to try to turn this on its head, but their argument is exactly false and opposite. The dollars that end up going to the abortion industry end up subsidizing abortion. This would turn that around.
We're talking also, let me just say this. Planned Parenthood alone performs over 350,000 abortions a year. Now, I mean, figure out how many that is a day. Do the math on that. How many that is a day? 350,000 abortions a year. Now, the fact is, on their health care planning services are a very small part, CC, of the services that Planned Parenthood engage. They are in the abortion business.
That was one of the critical things in a lot of the hearings that came out with Planned Parenthood is, they used to say we do cancer screenings, and they don't have one mammogram in any office, not one. So they don't do those health screenings that they say that they do. They are in the abortion business. That is what they do. Abortion.
I think back 30 years ago, it may have been different, or 40 years ago, it may have been different. They used to be in the schools all the time, and
they refer out. It's interesting. They refer out for all other medical services, but they do the abortion. That's the thing. They make the money off the abortion. So what they're doing is, we're paying for them to be able to refer out other services, like the mammograms and actual cancer screenings, which they don't have the devices for. But they'll refer people to places that do that. But when it comes to the abortion procedure, they're self-referring. They'll go and do that right next door. And that's what the law, the implementation of this law says, is that you can't have the same financial relationship and the same staff and apply for these funds. So you can't be self-referring for an abortion. So you can't be the person who says to do it and the person who says it actually carries it out.
They don't even want to do – the Planned Parenthood fights state regulations requiring ultrasound. And Logan, you and I have talked about this before, because they are doing everything they can to not show – the child is actually a child.
Right. And I think that's something a lot of our callers, a lot of our listeners are aware of, and they say that a lot. And it's something that you understand the situation from their point of view, because they're trying to say, no, they don't want you to see what's actually going on. And all of us have had kids in the last 10 years, have seen even the progression. If you had a kid 5 years ago, you had a kid 2 years ago, the progression
of the imaging
of the imaging that changes. So of course they don't, because it's closer and closer to, very early on, you're seeing real life.
Yeah. I mean, to the point of where you're seeing the babies in utero at, I think it was the first time they do it is 20 weeks? About 20 weeks?
Yeah, before then. Way before then.
Okay.
Oh, yeah.
I mean, real detailed imaging, but so there it is. All right, we've got a lot more ahead on this issue, and real battle ahead on this as well, I might add. And we're going to need your name on this petition that is going to be going with our comments. So we want to be able to say that there are so many people that have signed on to our comment section, because we're expecting Planned Parenthood. You heard what Dan's saying. I mean, it could be tens of thousands, hundreds of thousands of people on the other side of this. So you signing on to say we support this change, what the president's put in place here on the pro-life side, will make a difference. The number is 1-877-989-2255 to sign on to that petition. 1-877-989-2255. I encourage you to do that. Now, you can also, of course, go to aclj.org. That's aclj.org, and sign it that way.
The fight to protect life is intensifying. Now, with the Trump administration at the helm, efforts are ramping up to defend life and defund Planned Parenthood, the nation's largest abortion provider.
In reality, what abortion is the taking of an unborn child's life.
Planned Parenthood receives hundreds of millions of taxpayer dollars each year. And at the ACLJ, we're working with the Trump administration and members of Congress to stop the flow of taxpayer dollars to Planned Parenthood.
America will look back on this season in history and will be mortified about what happened in the abortion industry.
I didn't want anyone to see me. I didn't want anyone to know.
We're aggressively fighting on Capitol Hill to stop funding big abortion. The time to do that is right now. Add your name to our petition to defend life and defund Planned Parenthood. Call 1-877-989-2255. That's 1-877-989-2255, or you can add your name online, aclj.org.
So here's what the proposal from the president through the Health and Human Services does. It requires physical and financial separation between the Title X programs and facilities that those who perform abortion or support referrals to abortion. So if you do either one of those, you're not getting the money. That affects Planned Parenthood to the tune of about $60 million. Requires all Title X recipients to document and report potential instances of rape, incest, or sexual abuse, because some of these cases were coming in and the agencies, the abortion clinics, wouldn't refer the criminality of the situation over. So that's something the states have been pushing for. Requires parental consent for minors seeking family planning services at Title X clinics in most instances. So those are kind of the normal things that you would see put in place. But I'll tell you this, none of the funds appropriated under Title X shall be used in programs where abortion is a method of family planning. Here's what the president said of this, Bite 24.
For decades, American taxpayers have been wrongfully forced to subsidize the abortion industry through Title X federal funding. So today, we have kept another promise. My administration has proposed a new rule to prohibit Title X funding from going to any clinic that performs abortions.
So that's to the tune of about $60 million. I'm holding for our Facebook TV audience. Here is the regulations. Now, to do this change, it's about more than an inch thick, just to get this change in place.
This is what it takes to strip out regulations that have been on the books for decades. 130 pages to literally enforce one line in the federal code, Jay. That one line says, none of the funds appropriated under this title shall be used in programs where abortion is a method of family planning. That's what the Congress intended back in 1970. Ronald Reagan tried to implement it. Bill Clinton reversed it. And, Jay, not until President Trump do we have a restoration of that. And I'll say one thing about Planned Parenthood. They are now in the unfortunate position for them of having to simultaneously say, abortion is only 3% of our business, and at the same time, Jay, claiming that this change by President Trump will cripple them. It cannot be both, but I'll make a prediction. They're not going to separate their services because abortion is really at the core of their business model.
Abortion is their business, so I think we have to be clear with what the situation is. You're talking about $60 million from Planned Parenthood. It's a far cry from the $400 million, but it's 13% of that $400 million in the stroke of a pen and 130 pages of regulations. But understand this. They are going to be out there fighting aggressively. Let's go back to the phones. We're going to have to be prepared for a battle on this over the next 30 to 60 days. Look, this regulation went to the Supreme Court once called Russ versus Sullivan back in the late 80s, and we won 5-4. So this could be a fight. They may file I suspect they will file lawsuits. We have to be prepared. Let's go back, Logan, to the phones here.
All right, let's do it. Let's go to Andrew, who's calling in Texas on line 2. You're on the air.
Go ahead. You're on the air.
Hi there. Yeah, I run a Christian adoption agency in Southlake, Texas, and I just wanted to tell you, interestingly enough, about the timing. So I just met with a birth mother that had gone to Planned Parenthood 4 days ago, and the doctor said, very rudely, "Oh, you're too far along." So she decided to meet with me because I do adoptions, which is, and then to hear Donald Trump do this, which representing all adoption agencies, we say thank you to him. And also, what's interesting is I just got an email from somebody from the Huffington Post asking about same-sex couples. Do we work with them? Because it's just another form of attack. So,
but let me ask you a question about from the adoption agency. You're not getting any federal funding, though, right?
Oh no, I'm a for-profit private adoption agent. Yeah, so we don't. So because of that, I don't get any funding.
But you're saying you ended up getting a mother to come to you because the abortionist said you're beyond the weeks that they'll perform an abortion.
Yeah, she said that the people there were so rude to her, and she felt like
because
that's
their understand, Andrea, and you know this. It's because their business impact there is they lost a customer.
That's absolutely right. So when they talk about this critical reproductive health care and women and family planning, they're not talking about any of that. They don't care about women. They don't care about planning a family. They care about abortion. Period. Yeah. So that's why he's upset. He doesn't get to do an abortion.
They don't get to make the sale. I mean, that's it. It's a sale to them, and. Again, you look at you talked about how many a day. I mean, you're talking about probably you're edging up to almost 1,000 a day, so probably 800, 900 abortions a day. Their total non-abortion prenatal services is 4,000. I would imagine that in most major cities, a facility that does prenatal health for women that is not an abortion clinic, if you're in a major city, does more than that in a year in one city. And yet that's what Planned Parenthood does nationally. Yeah. Is 4,000 prenatal non-abortion visits.
Here's a question that people, I think, would ask is, what happens to this money? So, Than, the $60 million is, not, like Jordan says, not going out of the budget. It's being reallocated.
No, it goes to other centers that actually provide family planning services, and consistent with the law that was passed. So, Jay, it will go further because it will not be diluted down to a business model that is just funneling towards abortion. And so, the left is going to make this about health care for women. Jay, this will service more women. And in fact, Jordan alluded to some of these numbers, but I like to phrase it this way. 330,000 pregnant women walk into a Planned Parenthood every year. You know how many of those 330,000 get an abortion? 324,000. Only 6,000 fall through the cracks of that business model. That's pretty shocking.
Well, that means that their closure rate per unit, if that's how they look at it. By the way, they call it unit, is not about 97%. So you see, I mean, 97% of the people that come in end up getting an abortion.
Right. And the 3% might be just like what we just heard from our caller,
Just
someone
happen to
who's
be-
too far along.
Yeah.
And so they had to send them away.
And they fought, by the way, remember how they fought for the too far along? Because they wanted to be in the partial birth abortion business where they have the child partially delivered and then perform the abortion. I worked on those cases ultimately at the Supreme Court, and we won. But we tried them in New York and California, and they were fighting to do an abortion during delivery. That's the technique they were utilizing. So it kind of tells you what it is. All right, let's go ahead. We can grab another call, Logan.
All right,
I think.
Sure, yeah, we can go to Tom really quick in Connecticut on line 1.
Hey, Tom.
Yes, Jay. This is great news, but it's until we know who's going to be the watchdog to watch, because you don't think they're not going to lie about this.
Well, no. Here's the thing. It's the way the regulation's written. It's very cut and dry. There's not wiggle room in this. I mean, if your facility's performing abortions, you don't qualify. Period. And they're going to have to certify that under the penalty of perjury.
Right. And that's part of the application that they have to do that Jordan talked about earlier.
Yeah.
There is a long application, and if they do any abortions, they don't get that funding.
All right. So, Than, here's the question. We're expecting. We already are seeing it. I mean, we're already seeing the fundraising letters. What do you expect to be happening during the next 60 to 90-day period?
Well, in the next 60 days, they're going to be gathering those comments from us and the other side. I really do expect it to be in the hundreds of thousands, Jay. And look, let's just put it very simply. Those comments, Jay, are going to be the foundation for the legal challenge that will follow. This will certainly be challenged, and we're going to be in court just like we have been over the decades defending this regulation. And, Jay, one of the things that we'll be talking about is why this physical separation of facilities is so critical to actually enforce the law. Because, look, we've seen this at Planned Parenthoods for decades. They take the funds, they shift them around, and they use them elsewhere. The only way to achieve this is the physical separation of facilities.
Well, that's going to do it for the broadcast today. Let me encourage you to do something. We are in a real fight on this issue. I mean, it is a significant fight. So what we need to do, it's very important that we be able to take this position forward. We're expecting, you heard what Than and Jordan said, hundreds of thousands of comments coming in on the other side of this against this restriction of the $60 million to Planned Parenthood. We've got to be prepared to meet that. We're going to do that legally. You can sign on to our position paper in favor of this new regulation. You could do that by going to aclj.org. That's aclj.org, or calling us at 1-877-989-2255. That's aclj.org or 877-989-2255. We'll see you next week.
The fight to protect life is intensifying. Now, with the Trump administration at the helm, efforts are ramping up to defend life and defund Planned Parenthood, the nation's largest abortion provider.
In reality, what abortion is the taking of an unborn child's life.
Planned Parenthood receives hundreds of millions of taxpayer dollars each year. And at the ACLJ, we're working with the Trump administration and members of Congress to stop the flow of taxpayer dollars to Planned Parenthood.
America will look back on this season in history and will be mortified about what happened in the abortion industry.
I didn't want anyone to see me. I didn't want anyone to know.
We're aggressively fighting on Capitol Hill to stop funding big abortion. The time to do that is right now. Add your name to our petition to defend life and defund Planned Parenthood. Call 1-877-989-2255. That's 1-877-989-2255, or you can add your name online, aclj.org.